How did the position of the moon influence medieval medical practices? This is our research question, and to answer it, we're going to have to dive into a couple of interrelated astrological concepts. So, to set a bit of groundwork, it's important to note that in the medieval astrological belief system, the moon is deeply in tune with the human body. So, depending on its position in the zodiac, it exerts a different influence on a different part of the body. So, it circuits the entire zodiac in roughly 28 days, spending roughly 2 in each sign. And depending on which sign it is in, that part of the body that's associated with that sign is hyperactive. So, to better exemplify that idea, we turn to the zodiac man. So, the zodiac man is a humanoid figure with head to toe marked signs of the zodiac. So, from Aries to Leo down to Pisces, the entire body has points marked with zodiac signs. And these are in order of Aries to Pisces, that's the full circuit of the zodiac. And what this does essentially is show which body part is governed by which sign. So, for example, the heart here, Leo. When the moon is in the sign of Leo, the heart is at its most active. For example, for a physician, if you were diagnosing someone and they had some sort of heart ailment, you would not want to perform a heart surgery when the moon is in Leo, because the heart is most active at that time and most prone to inflammation and infection. So that shows when not to perform a given procedure. But how do you know the optimal time to operate? For that, we're going to have to look at the zodiac man again, but more specifically the elements associated with each sign and therefore body part. So each has an element associated with it. Back to our heart example, Leo is fire. So for our hypothetical patient suffering from a heart ailment of some sort, the optimal time to operate would be when the moon is in Virgo just 2 days later. And that is because Virgo is an earth sign. If we look over here to this diagram, Earth is directly next to fire, meaning it complements fire, and thereby tamps down the infection or the inflammation that fire would exert on the chest and heart area. So, a little bit more detail here. Every element has 2 sub-attributes. For fire, those are hot and dry. Now, to transform fire to earth, you need to switch out hot for cold, because earth also has the dry trait in common with fire. Now, the way these 4 elements work is that any element was seen as an imbalance. So to bring things back into balance, you would need to tamp out that hot fire with cold earth. Again, Virgo does that. Virgo is an earth sign, tamps out the fire. Leo. Every sign has a complementary element, and because the signs run in cycles of 4, downward repeating, you don't have to wait too long for the moon to enter the optimal sign. Now, where would this information have been found? This is a lot to keep track of, especially when you're out in the field diagnosing and treating patients. So the zodiac man, as well as these elemental details, would have been present in almanacs of astrologer physicians. Now, these almanacs would have been carried on the belt. This one in particular comes in a leather sort of sleeve case and unfolds. As you can see, there's a depiction of the zodiac man within these almanacs, oftentimes also some lunar charts, sometimes even volvels, which is the main focus of this presentation. Volvels, specifically the lunar volvel as we see here, are stacks of disks, essentially, that rotate on top of one another and allow the user to calculate various things. For the lunar volvel, it's used to calculate the position of the sun and moon within the zodiac, among other things, though that is the function that we'll be focusing on. Usually these volvels would have been made out of paper, as you can see with these 3 examples, although they were also made out of wood or ivory or even brass for the higher end models. But paper was most common, and for the paper ones, the volvel itself was bound directly into a book, as you can see here. This is the sort of the inner page. You can see the outline. So the base of this is the book page itself, and these additional 3 discs are stacked on top of that. And these might have been bound into books of their own, but they might also have been present in these almanacs and compendiums that the physicians carried. Now, let's move on to a bit of a more in-depth analysis of these volvels. So here I have a simulated volvel, and I'll be using it to demonstrate one of the problems we've mentioned previously, as well as explain the individual parts. So starting out with the back plate here, This has quite a bit of information. We won't be using all of it, mainly the date scale around this outer edge and the sign scale just inside that. These details right here are dependent on latitude and wouldn't have been consistent across all volvels, so we will disregard that. Plus, it's not used for astrological purposes. So moving up from the date scale and the sign scale, we have the sun disk. This is used to simulate the position of the sun in the sky over the modeled sky we have here. So this pointer would have represented the sun. Wherever it points is where the sun is. And on the inner side of that disk, you have the lunar age scale, which will become important when you need to set the age of the moon. Now moving to the moon, this is similarly to the sun pointer. This is a representation of the position of the moon. That's what this pointer's for. On the inside here, you can see a simulation of the lunar phases. So at the new moon, when its age is 0, or 0 days since the new moon, you could think of it that way, the moon is new. As you can see, it's dark. As you move the moon across the scale, you see it waxing to become the full moon at the 15th day. So at this moment, the moon is at its farthest position from the sun, directly opposite on the zodiac, and it's a full moon. Now, waning back to the new moon, that's the full cycle. So let's return to our heart surgery example. So pretend you're a physician and you need to operate on someone. They have a heart issue, but you don't know which sign the moon is in, and you need to determine when the optimal sign for the surgery is and how long to wait for that. So first step is setting the date. So for that, you would set the sun to the current date on this outer edge. So let's pretend April 15th, April 5, 10, 15, right there, April 15th. And we can see that the sun is in Aries, although that's not entirely relevant to this example. Worth noting, though. And now for the moon. So on April 15th, the moon is 27 days through its cycle. Now, if you didn't know that, as a physician, you could easily have determined that by looking in a compendium or almanac, as we saw earlier. Those would have contained tabulated lunar ages. So at this moment, we can see that the moon is in Pisces, towards the later end of Pisces. So Pisces is a water sign, and you could perform the heart surgery at this date, although the moon is very close to transiting into Aries, which is a fire sign, as we know, and that would not be the best thing to do in the case of a heart surgery, because the heart could become inflamed and potentially be more prone to infection. So the best thing to do in this case is to wait until the moon is in Taurus, right here. So that means waiting 4 days. Yes, 4 days. So from April 15th, as you can see on this scale, we have 15, 16, 17, 18, 19. So now the sun has advanced 4 days, still in Aries, but the moon has also moved. So starting at 27, we go 28, 29, new moon, now 1, 2. So having advanced 4 days, we can see that the moon is now in Taurus. It's a little bit obscured there, but moon is in Taurus, meaning that it is now an optimal time for the heart surgery, Taurus being an earth sign that will tamp down the infection and the fire of the heart and Aries, and offer the best possible chance of survival for the patient. Now, this doesn't really factor into this example, but when the moon is full, patients will bleed more. So, for example, you wouldn't want to let blood during this time or risk the patient bleeding out. So, fortunately, for this specific example, the moon is far from full, so we won't have to worry about that. But for certain illnesses where bloodletting is advised, You wouldn't want to do it close to a full moon on top of whatever sign associations there are with the whatever body part it is. But for the purposes of this example, we've determined how long to wait until the optimal period. So 4 days to get to Taurus,